that's when we enter depending on the percentage and the results, it generates an AI generated report that summarizes all the data. And then that generates a lifestyle teaching program. And this is one of the carve outs. And this is one of the methods that we use for lifestyle coaching. It depends on
so it generates an AI report that does what?
It's their lifestyle program. It's the coaching program for that specific patient. It makes recommendations based upon the patient's history, their blood work, and the Measura protocol. It makes recommendations for lifestyle changes that would be specifically improved. And if you follow those protocols, because it's using standardized protocols, it's not making them up. The average lifespan gain is expected to be 20 years, 20 to 25 years. The average health span gain is expected to be over 20 years. And so these are using standard protocols. The VA tested this already. We're using their protocols. We're using the Veterans Administration's protocols, and we've implemented them. So these are existing specific protocols that we've integrated and taken out of the studies, which are already proven, and implemented them into clinical care. And all of these protocols are already approved by the different societies. They're not coming up with new stuff. It just so happens we're integrating them differently.
Okay. So another question, maybe this is the same answer. It says, what does the test explains? I think you just answered that.
Yeah, it explains everything from what's causing your anxiety to why you don't get an erection to, what's your risk of having heart disease, what's your risk of having stroke. It puts all of that together. It tells you, why do you have numbness in your feet? Do you have pseudomotor problems or do you have vascular problems? Is it a nerve or is it a blood vessel? And so it gives you your risk factors for which component is causing what. Maybe both blood vessel and nerve, in which case it tells you, hey, you have this percentage of nerve defect in pseudomotor, and you should probably consider getting a nerve biopsy, but you also have this component of abnormal ABI, and you probably need to get an advanced blood flow study, and you should see a vascular surgeon. The recommendations are black and white. It's right on the sheet, because it's using traditional cutoffs, and it says most likely. Rather than saying you have to or you shouldn't, it says the statistical chances are this. It gives you the
percent. Okay. And how often can this test be performed per patient, you said?
It depends on the exact test and the exact history of the patient. It will lock you out if you're trying to do it too early, but typically between 4 and 8 months. It depends on the exact test. Like, for example, the vestibular balance can be done at 6 months again, but we recommend between 6 to 12 months. The respiratory quotient can be done in 4 months. We recommend 6 to 9 months. The pseudomotor ANS and ABI can be repeated at 3 to 4 months. We recommend 6. So it depends on the patient.
Okay, and you all would keep up. You all would have that MA keep up with that, right?
Right. Yeah, because it's in our system, and it gives us an alert saying, hey, this patient needs to be scheduled for this coming up in the next month, and we need to follow up.